So Ingrid and myself are from the Butterfly Day program. I'm a clinical psychologist and a manager of the program, and Ingrid's our dietitian, so we're going to tag team in the presentation. And as I said, ours is a bit longer, so I'm going to just skip through some of the slides fairly quickly, because some of them are just about who we are. So we're a specialist eating disorders day program. We're primarily a group therapy program, so a lot of what we're going to be talking about today in terms of assisting people to eat, we're going to be talking from a group dynamic perspective. We operate 5 days a week, quite an intensive program, and we can take up to 12 participants at a time between the ages of 12 to 24. Program objectives, so what we're trying to do is assist people to recover in many areas of their lives. So obviously the most important is the physical restoration that often has to happen for people with anorexia. But we do take people with bulimia as well as EDNOS, so sometimes that's not required, and it's actually weight maintenance that we're looking at for those individuals. We're trying to educate and address the factors that have contributed to the eating disorder developing in the first place and also maintaining it. We attempt to normalise the eating disorder behaviours for each individual. Obviously a structured transition is very important. The age range that we're looking at, they're often missing school or university, so to have a step-down process out of the day program is really important. So they're not away from those really important elements of their life for too long. And obviously we do take people as a step down from inpatient, and I think what we've shown is that has significantly reduced the amount of admissions that are actually occurring within the Southern Health catchment. Our eligibility criteria, the one I've mainly highlighted, which I thought was really relevant for today, which makes it a little bit easier for us, is that we are a voluntary program. So people have to be motivated to come and attend our program. That doesn't mean that we don't deal with an extremely high level of ambivalence, as everybody would know, but we're not taking people who are refusing to engage in treatment, so that makes our job a little bit easier. What we thought we'd start with in the idea of how we help people to eat is that we start preparing them for it even before they come into the program. So we do that by providing information packs to referrers, so the referrers are very educated about what the program is about and what their client is going to be required to do if they enter into the program. There's information packs for the families and the individuals as well. So everybody's fully informed before they actually come in and send a referral in, before that process even happens. The second part, which really helps people to prepare, is a handbook that we've created. So we've developed a very clear book that outlines everything that we do and why we do it. And obviously there's an extensive component that deals with consumption of meals, meal preparation and meal supervision in the day program. Each person that comes in has to sign that handbook. And that's really them saying, yeah, I'm willing to give this a try. Doesn't mean that they're 100% happy about the fact that they're coming. Doesn't mean that they're not petrified about the fact that they're coming. But they're able to say, I'm willing to give it a try, and we take that as a way of bringing them into the program. I've just put one of the guidelines on the slide, which really is important in terms of each person that comes into the day program has morning tea, lunch and afternoon tea with us. And we're very clear with them that they need to actually consume what they bring into the program. Ingrid will talk more about the concept that everybody has a meal plan that they follow in the day program. Each guideline that we provide has a detailed explanation about why we're making that a part of the process of the day program. So we try to make everything as clear as possible. Mealtime preparation, so everybody brings in their own food and there's a time frame that's given for them to actually prepare their food. So I think that's one of the important elements of the day program, is that it not only allows them to get used to consuming the food, they actually get used to touching the food again, preparing their sandwiches, having a variety of different foods. So the preparation obviously is to make sure that they're meeting their nutritional goals. We have between 2 and 3 staff, depending on the number of participants on that day, supervising in the kitchen as they prepare. The participants are responsible for making sure they have the amount of food that they need for that particular meal. And meal plans and snack lists are obviously used to assist the staff to make sure that each person is getting what they need. And there's a level of containment around the number and quantity of things that people can actually bring into the day program. No diet products are allowed on the premises, and staff are responsible for supervising the meal preparation and picking them up on any eating disorder behaviours that are actually occurring in the preparation time. So if they're trying to wipe margarine off their sandwich onto their skirts, then we pick them up on that, and they're asked to get more margarine out or to get a new piece of bread out to actually reapply the margarine. So they're always having 100% of what they need. Is this me? I can do it. Meal support. So another integral part of the program. So once we've all prepared our meals, which they have a certain period of time to do, then we all sit down at the dining room table together. Probably a little bit similar to what Michelle's described in terms of we have 2 staff at the table and we play distraction games around the table, and that's really a way of helping the participants not to get too caught in their minds and to have a chance to actually be a part of the group dynamic at that part of the day. And it's amazing their ability to be able to do that. There's a lot of laughing that happens around that table for most of the time. There's an enormous amount of modelling that occurs, so the participants obviously look to the staff in terms of pace of eating, in terms of the variety of foods that we have, and there's also obviously comparisons that happen across the table as well, and we'll talk about how we manage that. The eating disorder behaviours are addressed in the moment at the table as much as we can. We can't disrupt the meal. But we do prompt people on what we're seeing happen at that table, and there's extensive time after the meal, if required, to address prominent eating disorder behaviours that we feel are having a significant impact on the group. So we're monitoring, challenging and observing the eating disorder behaviours, and ultimately asking them to complete 100% of their meal in the required time, which they're well aware of when they sit down for the meal.